evening, viewers, and good to have you with us on the 9 p.m. edition of the Urban Debate. Viewers, first week really of the relaxed lockdown has now gone by. 5 full days where we've seen more relaxations, lesser of restrictions, but unfortunately, this is also leading to examples and many incidents that show that we are letting our guard down. Yes, of course, viewers, we have to gradually go back to a life where businesses start, economy starts to revive, and normal life or some glimpse of normal life is there. But we cannot forget the fact, viewers, that social distancing is here to stay. That's non-negotiable. It cannot be forgotten. The onus is on each one of us. The onus is also on the authorities on ground. The onus is also on the policy makers, because this is a big challenge for us. This is India with a high density population. It's not going to be easy for us. The minute we restart our public transport, open up our offices and our markets, there will be crowds. It has to be done in a planned manner. And why do I say that? I will give you some examples that have emerged just in the last few days. Violation number 1 was the water supply shortage in North Delhi that actually led to residents queuing up. Now, I won't blame these residents, viewers. What are they supposed to do? They need the water. Here is an example where the government needs to step up on availability of water, on sending in more tankers, on staggered timings. Violation number 2. As the ticket counters opened, hundreds began to throng to these rail ticket counters. This is again a visual that we got from the national capital today. We have to ensure this doesn't happen. Violation number 3. Residents buying essentials, but many of them not wearing masks. Now this is on you and me, viewers. We have to ensure this part. We have to ensure that hygiene and our own health safety is maintained. Gloves and masks, even homemade masks, if that's what we have, must be worn at all times as we step out at this point of time. Violation number 4. In a containment zone in Mumbai, we saw residents in a sealed premises roaming around freely. It's a sealed area with absolutely no movement allowed. But one look at the streets of this area and you will know that that's not being followed at all. Where are the authorities? Aren't they supposed to do this in Mumbai? Another violation number 5 from the city of Bengaluru. Ticket counters open, no sanitizers available at ticket counters. These are the basics that our authorities have to ensure. Violation number 6 from the Lokmanya Tilak terminus in Mumbai, packed with departing migrant workers. Now, somebody has to ensure that as trains are arranged for them and buses are arranged for them, somehow, somewhere, some amount of basic norms are observed. Violation number 7, an event was held in a hospital in Madurai. And of course, it was an event where there was a minister present, and so all that mattered was photo opportunity and not social distancing norms. These are just some of the reasons that has even prompted the Home Ministry, the central government, to issue a letter and send an advisory to all the state governments saying, please ensure that all lockdown norms are implemented, that social distancing norms are not violated. There are way too many examples coming, viewers. It will become disastrous for us. We don't want a situation where we go back in a state of lockdown. So yes, India needs to open up, but India needs to do it in a proper planned way with all the precautions. Let's say good evening to the panelists who are joining us right now. Sudesh Verma, spokesperson for the BJP, Dr. Ajoy Kumar, spokesperson for the Aam Aadmi Party, Abhishek Dutt, spokesperson for the Congress Party, and I also have Dr. Preeti Kumar, Vice President for the Public Health System Support and PHFI, joining us right now. Dr. Preeti Kumar, let's begin with you, because I believe it's just one more time and perhaps repeatedly in the coming days, we will have to highlight the importance of social distancing, that even if the lockdown gets lifted, we cannot forget this aspect of our lives.
Yeah. Quite right. I think one thing we need to understand is that it is broadly understood that when the lockdown was lifted, it did not mean the end of the epidemic. And therefore, as you rightly said, the issues about the non pharmaceutical methods of social distancing, of hand washing, of wearing a mask is now something that needs to be actually taken off by a very steep learning curve in the community. And when we talk about everybody following it, I think there's a little difficulty. For example, the knowledge about protecting ourselves is extremely wide in the community. People are aware about the epidemic, they are aware of numbers and statistics, they know what needs to be done. But there's a gap between knowing and following. And I think that is exactly where the community engagement becomes extremely critical. Mass awareness never really translates into personal behavior change, and that is where we need the messenger to actually ensure that what the messenger is, people perceive them to be the expert. The second one is community leaders. People look up to their community leaders. If they follow something, they are bound or maybe more likable or likely to follow it. The third one is that the practice, the whoever is actually preaching, the practitioner who is preaching has to practice it also. So a combination of all these factors is the only way moving forward where we can ensure social distancing in order to flatten the curve. But the learning curve has to be extremely steep if you want our epidemic curve to flatten.
Yes, absolutely. Because, if we let our guard down right now, then it's not going to be easy to win this battle against coronavirus. And Dr. Preeti Kumar mentioned, very rightly that the lockdown may be, partially lifted, but that doesn't mean that the epidemic has, gone away. Mr. Sudesh Verma of the BJP also joins us. Mr. Sudesh Verma, this has obviously come to the notice of even the central government. MHA has had to issue an advisory to all the states because we are failing to implement this on ground.
Yeah, it seems, the way things are, people are thinking that corona fear is over. Now lockdown is over. We can easily interact. We go to the market, the kind of crowd you see, You see, this is a country where we have to come out of the chalta hai attitude. You cannot expect the police or the army to do things for you because this is a democratic country. We cannot be like China or other countries that do not believe in democracy. They can impose whatever they want. So that is why these 2 months were used by various governments to create awareness about COVID and how to live, and it's just to learn the tricks and stay because you will be safe only when you wear mask, you maintain social distance, and you keep washing your hands. It's so simple in one way, but on the other hand, it's very difficult because we can understand the socio-economic condition, the density of population, all these govern against that. But yet we have to understand that if we have to live, we do not want to risk our lives, then we have to maintain social distance. And it is irrespective of social divide or financial divide or which ladder of economy or caste or religion you are. It doesn't matter at all these things. And we must understand. And here I feel a large role has to be played by non-governmental organizations. They are there in very large number. If they come out in the street and they start educating people and prohibit them, don't do this, create awareness, then probably it would be a clincher. That thing is not happening. It is only happening at the government level or at the level of the media or the level of advertisement. And we hope that these NGOs also understand the momentous task which is on their shoulder as well.
Yes, absolutely. Now, so while we highlight these instances, I also want to try and have a conversation about what can be done to ensure that we follow social distancing. Of course, constant reminders to people. People themselves have to be responsible. But Dr. Ajoy Kumar, do you believe that even the policies have to be designed in a certain manner? For example, yes, staggered timings for offices, for markets, even for industries is a good idea. But maybe somewhere in terms of implementation, we need to do a lot more. For example, what's the point of leaving only 1 hour gap between the timings for in different industries? Shouldn't the gap be more to ensure that lesser people are out there on the streets? Right now, we are seeing crowding in the Delhi buses.
Yeah, first of all, Tanvi, I think the issue also is, first of all, the curfew which starts at 7 p.m. One of the biggest rushes happening in the evening. when everybody is trying to make sure they reach on time. Now, if the objective is to have social distancing, then you need to have maximum more numbers of hours. In fact, people should be able to go up to 10:30, 11, 12 in the night. It doesn't matter. As long because the trouble is arising is at 7 in the evening, you're having everybody on the road, everybody rushing back, maximum number of crowding. So that's one thing we need to seriously look at. Because the idea is to stagger. Idea is not to restrict the number of hours so that the maximum number of people try to squeeze in the minimum possible number of times. The other one makes sense absolutely in terms of offices. But the factories have their challenge, how do you stagger it? I mean, can you stagger the the factory timings for different industries? Those are challenges. Probably the only way to do out is how can you minimize the number of people coming in, ensuring the physical distancing is there. But the crux, if you ask me, is the insistence of wearing of the mask. The mask should be worn all the time, and there should be a distance of 1 yard or 1 meter between everybody else. If we are following those basic things, we can. But staggering of office timings, yes. Staggering of vehicles in terms of whether it is odd even, whether it is employees who have got alternative and even what we call employee numbers, those are things we'll have to discuss it. But Tanvi, we need to talk to the industry for the solution. Right now it is too top-down. Okay, I've thrown some ideas on your TV show. Somebody's going to hear it and think it makes sense. The people who need to implement social distancing, whether they're physical distancing, whether they're people at the factory, people at the offices, people at the market, they need to come. They are the people who need to be consulted. And you will come with some very good ideas, whether it is the sabji mandi, whether it is the factories, whether it is the offices. These actual stakeholders need to be heard, and then you'll come with a solution. Otherwise, it's all top down. Civil servants sitting in their ivory towers, making this crazy. Every day there is a new order coming out. There is every day some kind of a new method to bring about this implementation, and that's why this whole chaos is there. There is no deep discussion. It needs to be discussed with all these stakeholders. We're still behaving like the British Raj right now, where all the government decides without any kind of interaction. And I firmly believe that the government needs to engage the people involved, the people who are the companies, the market people, the mandi people, and ask them what is the solution. But somebody.
No, you're right. But Dr. Ajoy Kumar, you're absolutely right. But my point is that needs to be done now. That actually should have been done earlier, before we went into this phase of lockdown, isn't it? Because every single passing day, as people crowd into the Delhi buses, we are actually risking their lives. We are risking the fact of cases going up and overburdening the healthcare infrastructure. So when will this happen is my question.
So Tanvi, the people who are in the bus, the fundamental people, a majority of people would have to go to work to earn their daily earnings. Now, the metros are not running. Everybody's getting into the buses what is possible. So, I don't know what again, obviously it sounds like blaming, and it is also a little of blame that Sudesh is on the panel. The government of India should have had a much more extensive discussion, because now you can't run the metro because the government of India doesn't feel it. And you are also limiting you are also saying only the buses will run. So the social distancing is totally out of the, what you call, ignored. And interesting example, there will be 2 people in the car, but 3 people in the plane can sit next to each other. So who are we talking to? Why are we making every day in the whole Indian population? The migrant issue also, the labor also issue is interesting. No state is talking the same language. Bihar talks something else, somebody else talks something else. So every day there's new rules coming up. I won't take the bus. I can send bus to Kota, but I can't take it from the border. I mean, so people are suffering because political and bureaucratic leadership want to implement whatever takes their fancy. There are 4,000 new rules which have come up in the 4,000 plus rules which have come up. So we are sitting believing Adesh de diya sarkar ne and everybody is going to follow it. And it's all, it's like, I don't know, to use an English phrase, it's like spitting into the wind. It's just going to fall on all of us.
Okay, I will go back to Mr. Sudesh Verma for a response on this before I go to Abhishek Dutt. But Mr. Sudesh Verma, do you want to add to this fact that constant, non-stop conversation has to happen between the governments? Yes.
Yeah, Tanvi, first of all, Dr. Ajay Kumar was a part of bureaucracy which is criticizing now. Nothing much has changed. And you see, when the exit policy was being devised, you know that the Prime Minister was talking all the time to Chief Ministers, have your own exit policy, and that is why various state governments, they evolved their own exit policy. He should rather talk about Delhi government because he's quite an influential person there and his word would carry a lot of weight with Kejriwal. You see, we understand the problem. You see, we cannot run metros without the social distancing norm. If airplanes are going to run, believe me, it is going to run in much under the capacity it can run. If railways are running, you will see that social distancing norms are being followed. Because if you want to start your economic activity, you have to implement those norms. And that is why there could be delay in running the metros. We have to devise a mechanism for that. But if you start running DTC buses, you have to implement those norms. You cannot say that Delhi is a very crowded city. That is why we can't do that. Then as well don't run it. So you have to prepare, lack of preparedness. That is why the exit policy was needed to be discussed at the state level, Dr. Ajay Kumar. Don't try to put the blame on the center. Center has given a lot of liberty, except for definition of red zone, quarantine and, all those zones. The state government has the liberty. And that is why you see all this chaos. Till this liberty was not given, there was no chaos. It was being implemented. And now you'll see at the airport, which is run by the center, you will see that social distancing norm has been followed. So we must appreciate, we must learn. That is why I'm saying I'm not blaming Dr. Ajay Kumar, not at all. I understand the problem Delhi government is in. I understand the problem Mumbai will face, the crowded cities. But that is why I'm saying that all these NGOs, we have to care the mental level of people. We have to counsel them, that you have to do it if you want to save yourself. And unless you are ready to derive this fear into them through counseling, you would not win all this crisis of migrant laborers and all that happened because we could not counsel them. That is, stay where you are, you will be given food, you will be given shelter, you are safest in Mumbai and Delhi and not in your own villages in case you catch COVID. This we failed to do, and our responsibility as well. Let's shoulder the responsibility together and walk ahead from here because we have a long battle to fight.
Okay, no, I just want to make this point after I've heard both of you that honestly, we had almost 2 months of a lockdown period, and those 2 months should have been used to devise this strategy, to discuss, collaborate, coordinate, and seal the strategy. Now is not the time to have conversations. By now, our strategy should have been implemented. Will it be staggered timings? What about public transport? How do we open up? Can we, without giving the public transport, allow people to start, opening their industries and offices? Delhi never had enough buses. Now, if we take away metro and start lifting the restrictions, it is going to be a problem. Mumbai is another different story. In Mumbai, we are not even able to implement the basic restrictions in sealed areas. I don't even want to think about a scenario where we open up and we don't have rules in place. Abhishek Dutt in Mumbai, even in the most crowded of the, in the sealed areas, it's as if everything is open, markets are open, people are roaming around. Now, if we don't implement basics right now, what will happen tomorrow?
See, I'll tell you where Mumbai and Delhi specifically are concerned. Both these two cities have a major issue with governance in terms of police. Most of the police officials are getting into COVID-19 problem. The moment one officer gets infected, there are 12 officers which go into quarantine. And if you look at the number of policemen in Mumbai and Delhi who are facing corona is a big number. So we must realize the center has to create some system of providing support in terms of policing and also in terms of controlling crowd, because in Delhi, I know 30% staff is available during the day. Most of the cops are either in quarantine or they are getting tested for COVID-19, which is happening everywhere because they are the frontline warriors who are exposed to this problem. Dr. Ajoy was mentioning about Delhi governance. I'll give you a very small example, which is very scary to all of us. Today, Delhi has reported more than 660 cases. And if you go on 29th April, there were merely 3,400 cases, and we had 102 restricted containment zone. Today, Delhi has got more than 12,000 cases, and we have just 70 containment zone. I fail to understand when the numbers are going up at a speed of 550 average every day, how come the containment zones are coming down? Which is very, very shocking and surprising to me. When we talk about social distancing, when we talk about that gap that Dr. Joy was mentioning, I'll tell you what the biggest problem Delhi and Mumbai are facing, and even Gujarat are facing today. Migrant laborers are going back. If you look at any screening center, one screening center has a capacity of 1,200 people that can take the train on one day. There are more than 5,000 people who are queuing up outside these screening centers, which all the media is showing. There is no social distancing. People are standing in queue. And my fear factor is when COVID-19 or corona positive people are traveling to smaller states, for example, when they go to a small town in Bihar or in Jharkhand or in any other state, they don't have infrastructure to control this problem. We are looking at such a major mass spread of corona that we can't even imagine. The problem today that I feel with the government is they missed a step. Today is the time when the proper lockdown in terms of states like Delhi, Mumbai is required. Delhi is reporting 660 cases. There are approximately 20 lakh people who are leaving Delhi, who are on the road.
No, but Abhishek...
So, this is the problem that we need to face today.
Abhishek, we can't be in a perennial stage of lockdown. I'm sorry, I disagree with you. We cannot be in a permanent stage of lockdown. Just because cases are rising in Delhi, in Mumbai.
Can I complete my point? See, you must realize what the Prime Minister has said. The Honorable Prime Minister very clearly said, let the state decide what problem that they are facing. Again, I'm repeating, Bombay and Delhi are peaking very high numbers. Haryana doesn't have that problem. Karnal doesn't have that problem. So in Haryana, the lockdown is very different to the lockdown in Delhi. If you go onto the roads of Delhi and Mumbai, there are lakhs of people wanting to go back home. And you have to control that situation. You don't realize if you compare Delhi to Karnal or if you compare Mumbai to another town in, which is very safe to a place like Goa, things are very, very different. And that
Oops, I think that line has frozen with Abhishek Dutt. We will go back to it in just a bit. But here is what I was saying to Abhishek Dutt. I disagree. Just because we are failing to implement the rules, just because the governments have not come up with timely policies, doesn't mean that we stay in a state of lockdown. That's not the answer to everything. Even today, Mumbai has reported the highest number of cases in a single day. In fact, numbers are just coming in. Mumbai has reported 1,751 cases in just the last 24 hours. In all, we've had 27,000 cases in this city. But that doesn't mean that we're going to be in a lockdown for 6 months. That means that in sealed areas, we have to ensure that the rules are followed. That means that in containment zones, we have to ensure that the rules are followed. Not that we open everything up in a haphazard way without any kind of policy implementation, any kind of planning. That's the point that I was making. Dr. Preeti Kumar, if I could come to you on this. From the policy point of view, there has to be a certain plan to this. India is a very unique challenge because of the sheer numbers we have. We open up public transport and then it's obviously going to become a big challenge. Shouldn't by now we have planned and designed a strategy for this, Dr. Preeti Kumar?
Coming to this point, we already have a strategy. So it isn't as if the states and the government does not have a strategy. There are, the data is being analyzed. Let me step back a little. I think the mediations have to be done at 3 levels. The one is societal, which we discussed just now about social distancing and wearing masks and hand hygiene and cough etiquette, etc. The other one was administrative, as was being talked about. What are the steps that need to be taken in terms of having plans for containment areas, for hotspot areas, for tracking and tracing and treating? These are policies which are laid down and broadly recognized and are in effect. The third critical one that we really need to talk about when we are discussing numbers is actually data and how the data is being visualized. With a population of 1.3 billion people, I think we really need to look at the data at a more granular level to really understand from where the cases are coming. Ultimately, 80% of cases are coming from 5 states. Within the 5 states, they are coming, most of those cases are coming from parts of our large metropolises. So, to talk about these numbers, we really have to be very careful. The second is our data. We also need to understand sometimes these data is about being reported are the cases and the test results have been coming. They might not be actually of that very day. So I think when we are looking at these numbers, we have to be more realistic. We have to have a more granular approach and then devise a strategy according to the granularity of those reports where those numbers are coming. The ultimate aim is what? The ultimate aim for us is our mortality and the death rate has to be very low. Thankfully, our epidemic has simply not gone the way of the other countries and in US. And therefore, we have to focus on that. If we are getting 6,000 numbers, of course, it's worrisome. However, 80 to 85% of these cases are asymptomatic. If they are asymptomatic, we have to ensure that there is quarantining, there is isolation. We have to keep a guard on these cases. But as long as this is not getting converted into high mortality, we can breathe a little easy while ensuring that our social distancing, mask wearing, behavior change gets strengthened progressively.
Yes. Social distancing, mask wearing behavior has to remain. That cannot go away. I believe Abhishek Dutt is back with us. Mr. Dutt, we lost the line with you. Go ahead and finish the point. And what I was saying to you is that even in cities like Mumbai, while we are reporting highest number of cases day after day, the solution can't be a 6-month state of lockdown. The governments have to come out with policies to ensure that there is a balance. Okay, we seem to have trouble with Abhishek Dutt's line there. We're going to go and patch it again. Let me go back to Mr. Sudesh Sharma and ask him this question, Mr. Verma. Is the onus only on the states now to devise these policies, or should there be some role from the central government as well? Because if it's left to each local administration, then we are going to see, chaos in some cities, leading to a spike in cases again.
You see, the central government's role is that of guidance, is that of providing the know-how, of course, providing the PPEs and all those equipments if the states do not have. But you see, primarily the law and order situation has to be dealt by the state. The center cannot usurp those powers. But you see, I see a big role, and I'm saying it again because I've analyzed it quite a lot. The state governments need to recruit counselors who would give, say, 1 hour or 2 hours on a daily basis and go to their allocated areas where they can counsel people to maintain social distance. Only this is going to work because policing is fine, but policing is not the only solution. And it is in that context that I'm saying that the role of NGOs we have not seen in such a massive way, which we see on other occasions. So they should be provided with those equipments that will make them secure, those counselors, so that they can go and they can tell people, they are articulate people, they go and tell them that why to maintain the social distance. Lot of problems will be resolved because of that, because people have suddenly, I see that people are not taking it seriously. They feel, oh, it's not needed, lockdown is over, and sometime in 2 months, 3 months, medicine will be found out, we will be safe. But these 3-4 months are very crucial period. This can decide whether India is going to win this war, or we are going to see an increase in number that will place us in a much adverse situation. Now we are in 16th position. Our figures are also statistically, envious. Other countries can be envious of our figures. But it is not going to remain the same unless we maintain that. So state governments have to do that. And if they want any advice or anything from the central government is, of course, they is committed to helping them. There's no doubt about that.
So, okay. Okay, my last question to Dr. Ajoy Kumar before I wrap up this conversation. Dr. Ajoy Kumar, the Delhi government had been wanting to lift the restrictions, saying that we are ready with our healthcare infrastructure. Now, while that is good, and you should have additional healthcare infrastructure because some amount of spike in cases is bound to happen. But how do we resolve the other issue? How do we ensure that the crowding in the markets, in the public transport, buses right now and metros later doesn't happen? There has to be clearer policy on how many people are stepping out at what point.
Look, Tanvi, before that, what Abhishek ji was saying, I just wanted to say that the reason why you're getting so many cases in Delhi is because you're testing more. And the more you're testing, the more cases you're getting in different parts. So the parts where we are not getting cases doesn't mean that the cases are not there. And I think the Delhi strategy to continuously increasing the testing, see, it's very strange. When we test more, you're going to get more cases. We are testing and locating people. People who are not testing are saying, by the way, I'm in a very good position, and then the serious cases will land up in the ICU. We are identifying. And second, the allegation was that how does the patient number increase but the containment reduces? So I would request Abhishek ji that, those are based on where they are. We are only basing it on data. We don't have any other reason to, why would we, cut our own nose to spite our face? The simple thing is we look at the areas where the number of patients are coming. Based on the number of patients coming, we lock that area. If there is no patient, there's one patient, why should we close down the whole area? If there is one person in a house, and they're spread over 20 houses, they're supposed to be in home quarantine. Let them be there. So that's not the issue. The issue in Delhi is we're testing more, we're going to get. But the important part, I think, is to ensure treatment to those who will reach hospitals. And the fourth point which Abhishek ji is saying is lockdown. Why do you think people are leaving the whole country, including Sudesh ji should understand, the people who are leaving is not Delhi, it's Bombay, it's Gujarat, it's Kerala, it's Tamil Nadu, it's Andhra, it's Telangana. Every person who doesn't belong to that state and has come from some other state wants to leave it because of the lockdown. Because the economy is stopped, there is no access to money, and it leads to a great deal. Why do you think the girl cycled from Haryana with her father on the back for 1,200 kilometers? It's because of this.
Okay. No, I take the point that you're making, but it's not about what's happening in other states and other towns and cities, Dr. Ajoy Kumar. It's the onus is on every state and every city. The ones that have cases today, the ones who may have cases tomorrow. There has to be a clearer, defined, well-devised policy and some amount of responsibility within the people as well, that we have to observe this. Now, in some cases, it can't be left to the people, because if they need water, they need water. Then the governments have to ensure that there is enough water. If they have to get to work, they have to get to work. Then the governments must ensure that along with the industry, they plan a staggered timing schedule and enough public transport is available so that the crowding doesn't take place. For the corporates, they have to figure out a larger work from home scenario, where you ensure that more people work from home so that there is less crowding on the streets, there is less crowding in our public transport. For people who are going to the markets, it's up to the local authorities to ensure that you don't just open shops for 2 hours or 4 hours. Keep them open for a longer amount of time so that there is less crowding in these market areas. Do an odd even kind of a strategy if that is what works. The solution to high number of cases cannot be lockdown every single time, viewers. We have to devise more strategies and implement better policies on ground. We're not done with this conversation. Social distancing was one aspect of it. The other is what happens when public transport and domestic travel opens up. Airlines have started, more trains are going to start. What's our consolidated policy for travel within our own country? That's going to be the big focus point after this short break. Stay with me right here on The Urban Debate. Welcome back, viewers. As India begins to lift the restrictions on domestic travel, whether it's by road, by rail or by air, all of this is gradually opening up. There is a concern about how we are going to track, screen, quarantine possible suspect cases and prevent infection from spreading. Do we need a consolidated national policy? Can it be left to the individual state governments? Can it be left to the discretion and mutual agreement between different states? Is it going to be different for migrants and different for trained travelers? some of the questions that we have. But before that, I want to play out an excerpt of this exclusive conversation that I had with the Chief Minister of Chhattisgarh, Mr. Bhupesh Baghel, and he raised the same issue. His concern was that as the trains begin from 1st of June and additional trains are brought in, what is the state supposed to do with the hundreds and thousands then land up? Are they to be put in quarantine centers? Are they to be home isolated? How do they screen them? There is no preparation for that. The state is not prepared. And he says the center is not telling us what to do. Take a look. जी इनफैक्ट ये सवाल सिर्फ ट्रेनों के लिए नहीं, ये फ्लाइट्स के लिए भी कल उठा था बाघेल जी कि जब मंडे से शुरू हो जाएंगे फ्लाइट्स चलना, तो वहाँ पहुँचने के बाद क्या क्वारंटीन या स्क्रीनिंग या टेस्टिंग का पॉलिसी रहेगा, और ये शायद उन्होंने राज्यों पे छोड़ दिया है। तो आपकी सरकार का क्या इस पे अभी व्यू है कि जो ट्रेन से हजारों लोग आ रहे हैं उनको क्या मैंडेटरीली घर में क्वारंटीन करना पड़ेगा या टेस्टिंग करना तो बहुत मुश्किल हो जाएगा? तो इसके लिए आप केंद्रीय सरकार से मांगेंगे कोई पॉलिसी या अपनी खुद की बनाएंगे?
देखिए, नेशनल डिजास्टर एक्ट लागू है और इस ऐसे में हर फैसला है वो भारत सरकार करती है और अभी तक करती आई है। अब इस मामले को क्यों छोड़ रहे हैं कि जो लोग प्लेन से आएंगे, एक तरफ हम लोगों ने जो मजदूर बाहर से आए, जो लोग अपने वाहन से आए, उसको हम लोग क्वारंटाइन में रखे हैं, हॉस्पिटल में रखे हैं, होम क्वारंटाइन में रखे हैं, लेकिन अब जो आएंगे उसको मैनेजमेंट किस प्रकार से होगा? दो प्रकार की व्यवस्था नहीं कर सकते। जो मजदूर पैदल चल के आए उसको क्वारंटाइन सेंटर में रखें, अब जो ट्रेन से आएंगे उसको आप घर जाने दें। ये दोहरा व्यवस्था नहीं हो सकता। या तो सब क्वारंटाइन सेंटर में सबको छोड़ दो या फिर सबको क्वारंटाइन में रखो। तो इतनी बड़ी संख्या में जब लोग आएंगे तो उसे किस प्रकार की व्यवस्था होगी? भारत सरकार को इसमें निश्चित रूप से निर्णय लेना चाहिए।
जी, इसके बारे में भारत सरकार से कोई डिस्कशन नहीं हुआ है क्या? राज्यों का जो आप लोगों की मीटिंग्स होती रहती हैं हर हफ्ते हर 2 हफ्तों में, तो ये क्या बात पे चर्चा नहीं हुई? क्योंकि कुछ दिन पहले हमने ये भी सुना रेलवे मिनिस्टर से, रेलवे मंत्री से, कि उन्होंने कहा कुछ राज्य हैं छत्तीसगढ़, झारखंड जैसे, जो ट्रेन्स के लिए परमिशन भी नहीं दे रहे, इसलिए अब तो उन्होंने परमिशन का सिस्टम ही हटा दिया है ट्रेन्स के लिए। तो क्या यहाँ पे कहीं प्रॉब्लम है कम्युनिकेशन की?
देखिए, ये भारत सरकार की अपनी व्यवस्था है और नाकामी छुपा रहे हैं। ये इन्होंने जब 2 राज्य की जब सहमति होगी तब ट्रेन चलेगी। अब एक राज्य डिमांड करे और दूसरे राज्य सहमति न दे तो ट्रेन चल ही नहीं पाएगी। हमने अभी 43 ट्रेनों की सहमति दी है, दर्जन से अधिक ट्रेनें आ चुकी है। 31 मई तक के हमारे रिक्वेजिशन है, हमने बता दिया है कि ये होना है। अब ये खुद कह रहे हैं कि 1 जून से कोई पूछने की जरूरत नहीं है। यदि यही फैसला पहले कर देते, सारे ट्रेन चला देते और राज्यों को सूचित करते कि मुंबई से आ रहे हैं, दिल्ली से आ रहे हैं, कि जम्मू से आ रहे हैं, लखनऊ से आ रहे हैं, कि पटना से आ रहे हैं, कि आपके त्रिवेंद्रम से आ रहे हैं, कहाँ ये बता देते तो आज लाखों जो मजदूर है कुछ सड़कों पे चल रहे हैं। वो ये जो भयावह दृश्य जो दिखाई दिया हिंदुस्तान में आज तक कभी किसी ने नहीं देखा, तो देखने की नौबत नहीं आती। तो आज अब ये कह रहे हैं कि
आप जो कह रहे हैं वो सही जी,
अब 200-300 ट्रेन चलाएंगे वो बिना परमिशन के। हमने जो विषय हुआ था, प्रधानमंत्री भी हमने यही निवेदन किया कि राज्यों से सहमति लेकर ही हवाई और रेल यात्रा शुरू करनी चाहिए, और इस प्रकार के पत्र हमने भारत सरकार को लिखा भी। लेकिन अब वो एक तरफा फैसला किए हैं कि अब तो ट्रेन चलेगी, हवाई जहाज चलेगी, राज्यों को पूछेंगे नहीं, अब वो उसके रहमो करम पे छोड़ दें। ये कौन सी बात हुई?
So this is what the state Chhattisgarh chief minister is actually saying, that what's the policy? How can we have one policy for migrants and none for the other train travelers? On the same aspect, when the aviation minister Hardeep Singh Puri was asked about domestic air travelers, he said, well, it's not really possible to keep quarantining such large amount of people. Again, there is no very clear policy there, but he kind of gave an indication of what the center was thinking. So what happens then? Is it to be left to the state's discretion, or do we need a comprehensive policy? That's the big question. Tuhin Sinha, a spokesperson of the BJP, joins me this evening, and Abhishek Dutt of the Congress party continues to stay with us. Tuhin, let's start with you. This is a big issue that's been raised by the Chhattisgarh Chief Minister, but also in general, as we open up our domestic travel, should there be uniform rules?
Tanvi, let me take a macro view of the entire problem. Across the world, the entire COVID management has been a smart trade-off between when and how to go into the lockdown and how to reopen the economy. So we went into it pretty much at the right time, and the results show. Now, 2 months later, as the aviation minister, honorable aviation minister has explained, it was not tenable to go ahead with the lockdown. But these 2 months had to be utilized by each state government to spruce up the medical preparedness, the testing in their respective states. If you look at it, the maximum complaints or the maximum grouses come from those states like Maharashtra and states like Bengal, which have anyway always put the onus on the center. 2 months into the lockdown, I think each state government should be in a position to devise a strategy of how to take care of it. Because frankly, at this point of time, 2 months ago, nobody really knew how the COVID-19 would pan out in the country. But at this point of time, it is not possible to restrict the spread. What is possible is to reduce the already low mortality rate by providing medical facilities and hospitalization at the earliest. And when a state like Maharashtra, even today in Mumbai, at least, you would be aware, at least 2 patients have died because they didn't have ambulance. So if a state like Maharashtra, which has anyway been sleeping, would have grouses. But look at Uttar Pradesh. Uttar Pradesh is ready to welcome all migrants. Uttar Pradesh is ready to to receive all travelers because they have utilized these 2 months to put the necessary apparatus in place to make their COVID management successful.
No, I understand what you're saying, and of course the state governments within their own states have to look at COVID management. But when you start opening up travel and hundreds of these people get on the trains and reach different locations, then what should be the policy? Because when the migrants movement started, then all the states were told that you should ensure that they are home isolated or quarantined, and most states were actually quarantining them in specific centers. Now, obviously, Tuhin, that won't be possible once the train, full-fledged train movement starts.
I'll tell you, Tanvi, the increasing realization was that not starting normal trains or normal aeroplanes was being counterproductive. Because the rate at which, the scale at which people actually wanted to travel, and unfortunately, you can't hold back people after beyond a point of time because they were, they had personal issues, they had business issues. So, holding back operations of aeroplanes and trains were actually turning out to be counterproductive, and people were anyway rushing, in their private vehicles. I know of people who have traveled from Mumbai to Patna in their cars without any, necessity. So I think this is a wise decision. At the same time, let us also realize that these would be responsible travelers. These would not be, migrants who are just fleeing out of the city because they were finding it difficult to survive over here. These would be responsible travelers. Insofar as air travelers are concerned, they would be regularly tracked through the Arogya Setu app. Insofar as the train travelers are concerned, I can tell you for a fact that you can go through all the surveys. I don't think anybody is going to make a pleasure trip at this point of time. Only people who have been stuck away from the families and who had families would be traveling, or those people who had pending business work would be traveling, and it is expected that they would, follow the necessary guidelines and report the moment they have symptoms or the moment they see a red flag.
Okay, but let me bring in Mr. Abhishek Dutt also on this. Mr. Abhishek Dutt, do you think there needs to be more clarity and a consolidated policy? Many people who are now booking tickets on train and even plane, they don't know what if they land on the other side and then they are told that you have to be quarantined or you have to, be in isolation for 14 days. Now, should it be left to individual states to decide?
Yesterday when I was watching Mr. Hardeep Puri's press conference, 2 strange things that I heard for the first time. First, a reporter asked Mr. Hardeep Puri that you were supposed to be flying the plane in 50% capacity. Mr. Puri said there is no need for social distancing in flights. On one side, you're saying there is no need for social distancing when you travel on a flight for 12 hours. Then you say when you travel on a domestic flight, you don't need quarantine. I fail to understand trains are going in 50% capacities, buses in Delhi and all over the country are going in 50% capacity. Your minister is saying something else today. The department is doing something else. So they don't have clarity within themselves. Second point, when a poor migrant, well, when Mr. Tuhin from BJP was speaking, he was talking about people doing their business trips, people driving from Patna to Bihar. I fail to understand this government has missed out on crores and crores of people walking with their kids, pregnant women, women with 2 months old kids walking on the road. No one spoke about them. For them, you had all the rules applicable. They were supposed to be quarantined. They were supposed to be screened. There were no trains for them. They were walking on the road. There was no arrangement. Suddenly, you talk about a business person who's concerned about his business travel. What was more important in the last 2 months? A migrant reaching home by foot or a business travel from Bombay to Patna? And it is very surprising even today. See, I understand the economy has to open. You can't go, but the government has to have a clear stand. If you can avoid a flight, that means if today an individual can take a flight from Bombay to Delhi, he skip his quarantine. A person who comes on a train to Delhi goes in for a 14 days quarantine, then he reaches home. And all the rules are applicable on him. I'll give you a very small example. When a bus has to travel 1,000 kilometers, the cost of that bus is more because the capacity is only 50%. A 40-seater bus carries 20 people in it, and the cost is very high. But in the plane, you have 100% capacity. So how can you have two different guidelines for two different sections of the society? One, the Richie rich, and B, the commoners who's dying to get back home and are dying on the highway every day.
Okay, Tuhin, you want to respond to this? How can we have different policies for migrants who are being forced to walk, have no money, have no food? They are being put in isolation centers and quarantine centers, but everybody else, it's all right?
The kind of safeguards which have been put in place for air travel is unprecedented. Disposable face shields, disposable face masks, disposable hand gloves, which will ensure that the transmission of disease would, at most be 0.5 or 1%. The kind of arrangements, if your correspondents go to the airports, and I'm sure they have, besides the Arogya Setu app specifically would track these travelers, and contact tracing would become very effective. But the point is, if you don't start this air travel, like I've said, there are so many cases of people just making, traveling by cars and by, making all the other arrangements which are actually going to be counterproductive. So I think this was a tough call, but at the end of the day, with a 0.2 mortality rate out of lakh, which is the lowest in the world, I think India is in a position to take that risk. Now, the onus is on each state government to ensure, like I'm asking Mr. Abhishek right now, can their state governments in Maharashtra or Rajasthan, can they make this claim that they can get a serious patient of COVID admitted to a hospital in 90 minutes? If a state government can make that claim, I think they would be in a position to handle the effects of this travel. But the economy can't be in a frozen, infection.
Okay, no, okay, if you say that all the rules and social distancing norms and all the precautions are being taken at airports, fair enough. But what about the trains? Starting June 1st, we'll have 200 more trains. The concern that some of the other states are raising is that when thousands of more people begin to arrive via these trains, then what happens? What's the policy there?
See, till now, all the migrants had to be quarantined. But like I said, beyond a point of time, we have to get on with normal lives. To my understanding, face shields are still being provided in the trains. There are 200 COVID centers which have been set up across different stations. But point is, I think, beyond a point of time, everybody agrees. 2 months ago, probably each country had a different perception about how COVID-19 would spread. But at this point of time, the spread has been unabated, and pretty much every country realizes that you cannot restrict normal life. You have to get on with it with the maximum safeguards and with the best medical preparedness, which is what we are trying to do.
Okay, I will take that point and I will take it back to Abhishek Dutt. Abhishek Dutt, every state had 2 months to prepare, 2 months of lockdown to build your health infrastructure, to devise your policies and keep them ready for when the lockdown gradually begins to lift. Now, how can we sit and complain that, oh, we weren't told, we weren't given time, we are not ready? You had 2 months.
No. I want to ask my friend one thing. I stay in Noida, for example. I'm talking about a migrant worker. He has to go to Gorakhpur. It's been more than 2 months. Do you have any bus service to transport a person in Noida to go to Gorakhpur? It's been 2 months. You don't have that facility. What you have done today by opening up trains without permission of the local state government, you could have done this before. I'll tell you one thing. If you look at the 7th schedule of, Article 81 7th schedule, it very clearly says the power of migration and the power of quarantine is with the central government. All these powers are vested with the central government. Who had stopped the central government for doing this before? Why from June the trains are going when most of the people have already left barefoot? How can you miss? You're talking about Arogya app, you're talking about people flying with face mask, you're talking about a very, very selective, limited population of our country. I'm talking about the masses who don't have mobiles today, who don't have foods today. 2 days back, there was an article in Hindustan Times and Times of all the people carried it. People in Delhi, this is the reading of the Honorable High Court of Delhi. People in Delhi left because of no food. Was that the arrangement done by the Delhi government, by the central government? A police constable of Delhi police, who died in Delhi because there was no bed available. And Delhi, one second, I'm talking about the arrangement done in Delhi. Delhi comes under central and state.
I know you're
there
very...
are no beds in Delhi. No, my point is that how can the government ignore the masses?
You make a valid point, Abhishek Dutt. You are very closely related to Delhi, so I know why you feel the same there for the people of Delhi. But the same point can be raised by me for Maharashtra. No, what about the pain of migrants in Maharashtra? Isn't Congress in alliance with NCP and then Shiv Sena letting down the same migrants here?
Why are we?
It's the same story whether it's Karnataka or Maharashtra or Gujarat or Rajasthan or Delhi. Now you can't say that in Delhi migrants ran away because they had no food and no government support, but the story was different from Rajasthan or Maharashtra. I am just saying that problem aside, there needs to be a comprehensive policy.
Absolutely.
And that is the issue here. I'm sorry, I'm completely out of time. I understand the point that you're making and Tuhin was making. Yes, but if the center hasn't given a policy, now the states need to come up with some or go back to the center. There is a meeting that happens between the Prime Minister and the Chief Minister almost every week. There is discussion beyond that. Central teams are visiting the state. There is conversation between the bureaucracy. These issues should have been sorted out by now. But if the central government hasn't come out with a policy, whether it's for air travel or train travel or road travel, the states need to give clarity. People are wondering what's going to happen. They catch a train today from here, go 1,500 kilometers away, reach another state, and then they don't know whether they will be quarantined or put in isolation centers or allowed to go home. And also, how can we have different rules for migrants who are traveling and other train travelers? Perhaps it is time for the governments to look into this issue before we further lift up the restrictions on travel. And I am not advocating putting more restrictions. I am saying opening up with better policies and better implementation. That's the point that we've tried to highlight here on the 9 p.m. Urban Debate via both of our conversations, viewers. The solution cannot be locked down. The solution has to be better policy, timely policy, and better implementation at every single stage. Living with corona is a fact of life. How we do it defines how we win this battle against corona even in the long term. That's what I was talking about. Completely out of time on this edition of The Debate. Thank you so much for joining us.